shoulder pain, solution number one. So you're going to do the thumbs up exercise. Thumbs up, thumbs down. So whether you have like frozen shoulder, or it's like you're in a limited range of motion in your shoulder, or frozen shoulder, or scapular pain like back here, even shoulder pain up here, you're gonna go thumbs up, you're gonna go thumbs down, thumb to the side. You go like this, and you're gonna rotate. You're gonna do this 30 times, right? 30 times. You can do it for both shoulders. This is gonna help exercise the muscles, the small muscles, tendons that are in that shoulder joint, and also exercises these muscles back here, because these also, you'll feel it flex up here. So do this 30 times, right? So 30 times is one session, right? You can do this at least 3 times a day. Make sure you follow me here for more of these awesome.
I came to see Jimmy for a host of things, back problems, knee problems, problems with my hand, and the transformation's been just amazing. I was able to do a really long bike ride this weekend that I couldn't do before because of pain. So really happy with that and just how I feel overall. And I would definitely recommend Jimmy for anyone. In fact, I have recommended him to several other people, and I'm just thrilled with my progress.
And today is Tuesday. So Tuesday we're going to talk about Treatment Tuesday. So this is another daily power tips. And so Tuesdays and Thursdays we talk about treatments. And so what we can do, at-home treatments, self-care treatments. And so I'm continuing on the list that one of the comments Lucy asked. And so one of her, the list that she had was about shoulder pain and bicep pain. So what can we do at home for shoulder pain and bicep pain, right? So there's different parts of the shoulder. So let me, when we refer to shoulder, I'm assuming, Lucy, that you're saying this part of the shoulder joint, and really where the bicep attaches, right? So you've got your shoulder joint, your shoulder muscles, your deltoid muscles, and then you got your biceps. And basically you're probably having pain around this area, or this shoulder right here, or right here. And so let's just say that the pain is right in the shoulder joint. So I'm pointing right here. So what I'm going to teach you today is something called my QRA, and it's called Quick Relief Acupressure. And in our clinic, we call it Quick Relief Acupuncture. We actually use, acupuncture pins to actually relieve shoulder pain very quickly, okay? So, but you can do the same thing, but not with needles, but you're gonna use your finger, okay? So this is Quick Relief Acupressure, QRA. So if you have shoulder pain, let's say in the joint, so one thing that you can do is, let's say that this is my right shoulder. So if my pain is my right shoulder, you're gonna go to your left shoulder, okay? You're gonna find, first, in your right shoulder, you're gonna find out where the exact point of pain is. So move your arm around, move your shoulder around, and trying to figure out where exactly is that pain, because that is vitally important. So if the pain's right here in the front of your shoulder, then you're going to go to the same place in your left shoulder. This is my left shoulder, okay? You can go to the left shoulder, and you're going to find that same area, and you're going to push around, okay? You're going to push around until you find a tender spot. I guarantee you will find a tender spot. Even though your left shoulder is not the problem, but there is a corresponding point on your left shoulder that will treat your right shoulder. So you're gonna find that tender spot in your left shoulder, okay? This is my left shoulder, I'll tell you, this is my left shoulder. Left shoulder, you're gonna dig around, you're gonna find that really owie spot. And when you find that owie spot, you're gonna press super hard for 10 seconds, right? So you count to 10, you can massage it, make it really, it's gonna hurt, okay? So that really tender spot. And then after you're done, release it, obviously, and then test your right shoulder again, okay? It should have reduced this tender spot in this point, okay, in your right shoulder. So then if you have, let's say you have multiple areas in your shoulder that's hurting, so then you're going to palpate, you're going to find those, move your shoulder around, and find where is that specific point. And then, again, if it's, let's say it's in the back, maybe it's in back here, right? It's back here that's really tender. So you're gonna go to your left shoulder and push around and find a tender spot in the back, in your back. And when you find that spot, dig in deep for another 10 seconds, okay? Another 10 seconds, you gotta make it hurt, okay? on your left shoulder, and then release it, and then move your right shoulder again, and see how that feels. Again, that should instantly reduce that shoulder pain. Okay, this is my QRA, quick relief acupressure. Now, if you have it in the biceps, right, you want to find out, okay, is it in the muscle, the belly of the bicep, or is it actually in the tendons, right, where it attaches, right? It could be down here in your elbow, where where it attaches to the bone. Wherever, you got to find that exact point. Is it in the muscle, or is it in the tendon? If it's in the tendon, then you're going to go, let's say it's right here, right? My bicep pain is right here. Right here in the tendon, okay? Not in the belly of the muscle, but in the tendon. So in the tendon, you're going to go to your left bicep. Same thing in the tendon area. You want to find the tendon. Find that tendon where it's super tender, and then, like, oh, this is pretty tender right here for me. Press super hard, dig into the left bicep tendon, and really massage it for 10 seconds, and then come back and test it out again. Test it out on your right side. See if it's better. It should be better, okay? So if you feel the pain on a tendon, you have to find a corresponding tendon and press on the tendon. If you feel the pain on a muscle, you have to find the corresponding muscle and dig in on that muscle. If you find it, like say on the acromion process, which is just this pointy part of your shoulder joint, if the pain is on your bone, then you have to find the corresponding bone and press on the bone, okay? Like treats like, right? Like treats like, okay? So that's how I treat my shoulder, my patients with my shoulder pain and bicep pain. And you can do this at home. You can do, if you're outside. If you're outside, I play tennis, and sometimes we get some shoulder pain. I'm pushing on my opposite shoulder to relieve that pain and pressure. It is temporarily, okay? But because you can't just do it, expect to do it just one time and the pain will go away. You got to do it every single day, okay? And so I do that when I'm playing in between my, during my matches. If my shoulder's hurting, I'm going to be pressing and self-treating myself during the match, right? And so that's how I protect myself. And also, I don't have to pop like Advil, ibuprofen, because I'm self-treating myself while I'm playing the game, okay? So those are just a few tips on how to treat shoulder and biceps. Again, if you want me to talk about any other type of joints issues, pain issues, or anything else, basically comment below and let me know what you want me to talk about. You have to let me know specifically, okay? Becky, I can't read your mind, so you gotta tell me exactly what you want me to talk about, all right? Hopefully this was beneficial. Comment below, like, share this post, share it with your friends, family, and comment below and let me know what you want me to talk about on Tuesdays and Thursdays. Tuesdays and Thursdays we talk about treatments, all right? Self-care. All right, guys, Jimmy Yan from Achieve Integrative Health. Remember, always, everything in life is achievable.